Hi, I'm Sasha, and I've got my eye on news for you. In this part of the show, we're going to tap into the thoughts and emotions of the Northeastern campus on national issues. Today, we will discuss the highly controversial healthcare reform bill. As many of you know, there has been much debate on this issue. Let's see how the Northeastern campus feels about it. Are you familiar with the new healthcare bill?
I am.
What side are you on?
I'm definitely in opposition to the bill at this time. I think it's just another form of control.
If you were to lose your healthcare coverage, what would you do?
I'd definitely be in a bind. I know that, especially now with the new healthcare reform, that it would be a lot more heavy on my life if I lost it. So,
Thank you. Are you familiar with the healthcare bill?
I'm familiar enough.
Do you have a side?
I am against it.
Why?
Why? I just feel like it's just taking too much power away from the people. I really feel for my grandma whenever she's gonna have to. She's getting pretty old and she's not in the greatest of conditions, and in the greatest economic conditions as well. And then she's gonna have choices to make, and the government's gonna make those choices for her. She won't really have a choice for that, and that's what kind of bothers me a little bit.
Do you have health care?
I do.
If you were to lose it, what would you do?
Cry.
Thank you very much for your time.
No problem at all. Thank you.
I just really know a little bit about healthcare. I just think that a lot of people delay getting the the surgeries that they really need in fear that they're going to go in debt with their bills of healthcare. Everyone deserves free healthcare. I mean, you really can't deny anybody free health. I think that it's divided just because the rich want to stay rich and and they don't want the poor to. I mean, the rich have their money and they're satisfied with that, so they want to keep their money, and that's how I feel.
I think the only reason why people are so divided about it because, the people that already have good quality health care, they don't want to give up any of theirs just to help, the people in the middle class and the lower class regions of America. So they just want to keep what they have to themselves and just, every man for themselves.
Well, I'm 22, so in another year I won't be having health care because the insurance drops off at 23. Well, I just, learned that. But, yeah, right now I have it, I'm on my mom's plan, but it bothers me. In a year, I want to have health care just because, I'm a college student, you know what I'm saying? It bothers me. I could just be dropped from health care just because of my age. So, I don't know, that bothers me. Trey?
Yeah, currently I have health care. And another thing, a disadvantage I think about this bill is that people with health care that's paying to have health care, some of them will drop it because now they get free health care. But at the same time, I think it's more of an advantage because there's more people without it that's going to need it than there is with it that's going to drop it just because they get it for free. And in a few months, I'm going to be a parent. So it's good to know that I can be a newly parent, still in college, and knowing that when my son gets here that he's going to have free health care and going to be taken care of.
I do have health care at the moment and an insurance policy, and my son also has health care too. So, I mean, if this bill makes health care better than what it is, then, hey, I don't have to worry about my son hurting himself and me not being able to afford it. So, yeah.
That's all we have for you today. Tune in next time for us with more news here at NSU TV. If you have any comments or suggestions, you can contact me at bunchsd@mail.nsuok.edu.